So Pranav, do you think medical tourism will go away? Because you're able to do this kind of remote surgery from wherever you're sitting.
I don't think so. I think there's still some time because what I actually feel is all these latest technologies, most of them are actually able to penetrate the first 1 billion. But if you see, the remaining 7 billion people are still untouched. I think, so I think there's still some time for it, and it'll take almost another 25, 30 years for the rest of the world to catch up with what's happening in the developed nations.
Yeah. No, that's a good point though. I think when we talk to a lot of our clients, one thing has become, and you referred to this earlier, is that the pace of transformation, the change over the last 2 years, would have taken normally 10 years. And thanks to COVID, the good parts in COVID as well, that we're able to see the transformation speed up quite well. Back to Rickard, your point on what are some of the challenges you face in terms of this, as you alluded, this technology being more mainstream and the advancement in the technology?
So I've worked in technology for 30 years plus, and whatever field of technology you're in, it kind of always does the same thing, which is Gartner talk about the hype cycle.
Yep.
You have that explosion of excitement. You have a lot of different ways of doing something. They all go off in their own direction, and then things start to calm, and then they start to consolidate. And whilst that's happening, and you start to get 2 or 3 kind of ways of doing it, whilst that's going on, Moore's law continues to apply, which is that things get faster and cheaper exponentially. And so when you look at this space and you look at the challenges, I think it's exactly that place. At the moment, it's a bit like that. Soon it's going to become like that as it consolidates. And the technology, the headsets, the processing powers, NVIDIA are up just now, the GPU powers, they're moving so quickly
right.
that what we can do in terms of fidelity, in terms of realism, in terms of interaction, is massive compared to where it was even a year ago. And then when you start to bring in edge computing and 5G,
right.
That's when you start to move things into other parts of the world.
Yes.
And you can start to move that through. And we do it today. So we work with Orbis, an eye charity, specializes in developing nations. They send our equipment to those nations because it's cheaper than sending a doctor.
Yeah.
The doctor remotes in, comes in virtually,
Absolutely.
and then guides them through. And I think that's the start of that democratization,
Correct.
which is what's got to happen, right?
Correct.
Yep. Pranav, in your area, biogenics, what do you see some of the obstacles? And because I see a lot of accidents happening and paraplegic people, I mean, that's almost giving them a new lease on life. What are some of the challenges and how do you see the future of this evolving?
Most of this medical devices sector itself, one of the major challenge that we see is actually in regulation. Because there are multiple regulations that you have if you have to make a medical device available in most of the countries. The major difficulty is everyone have their own regulations, and it's extremely, and for startups, and you see that there's a lot of innovation happening in startups, and they really do not have the financial power to actually make sure they finish the regulation tests and compliance for almost all the countries, right? So if there is a global unified regulation that can take care of all of this, that's actually one of the biggest bottlenecks in the medical device industry. And the second thing is also in terms of tests. For non-invasive devices, it's pretty much easier. But the kind of tests that you have to do, the user tests for almost like for all the invasive devices, medical devices, is extremely difficult. I mean, it takes almost 7 to 10 years for us to even finish all the required tests. So I think AI can play a bigger role. Simulations can play a bigger role in this particular domain.
Awesome. No, you remind me, a few years ago we were building out this electronic health record for a company, and we were this close to being classified as a medical device. And if that happens, you go through like years of FDA approval and all that stuff, so that's not fun.